Today I'm going to talk about cancer on the vocal folds, and this is a very important topic. Now, most of the time when people have hoarse voices or they notice something's not working quite right with their voice, it turns out to be something that isn't very serious. So hoarse voices often pass. They're sometimes to do with a little bit of pathology like nodules or perhaps a polyp or just some inflammation or the fallout from a bad cough or a cold. However, there are times where it's something more serious. That's why we voice therapists always recommend that people check out hoarse voice that's been going on for more than 2 to 3 weeks. We ask you to go and see an ENT doctor so that they can take a look at the larynx and just see what's going on. Is it just a bit of inflammation? Is it just a bit of redness? Is it due to reflux? All these things are often spotted when there's a bit of a hoarse voice problem. Sometimes there is a bit of pathology, as I said. But in some cases, and it's quite rare, but it does happen, and it can happen to anyone, there is sometimes some cancer on the vocal folds. Now, it's so important to get this diagnosed early. Sometimes when they take a look, they do actually see there is something on the vocal cords. Usually it presents as white little plaques, and it could be on one vocal cord or one vocal fold, and I'm using vocal cord and vocal fold interchangeably because that's what most of us do nowadays. So if there are some white little growths on the vocal folds, they will then take a biopsy. They'll take a look at it for you. They'll do a little surgery to take some off and have a biopsy and send that off. And if it's found to be some kind of dysplasia, some kind of white plaques that grow on indicating cancer is coming or is on the vocal folds, they will then do another surgery to surgically remove that. And this is when the growths are very small and will be on the top of the vocal cord and often quite easy to remove surgically. In some cases where things progress and more time has gone past, those little things might turn into a growth. So there'll be a growth on some part of the vocal fold, and depending where it is, towards the front or the back. If a growth is found and it's quite large, it becomes much trickier to remove it with surgery. And sometimes this approach will still be taken, perhaps more than one surgery to fully remove it, but it can be quite detrimental on the voice and also cause scar tissue, just like any surgery. And of course, the bigger the growth, the bigger the amount of scar tissue, and so possibly the more voice compromise there will be. Often in cases where the growth is quite large, the main course of treatment will be radiotherapy, and it will be targeted radiotherapy on the actual growth, about half an hour a day targeted around the area where the growth is. In the beginning, this doesn't have such a detrimental effect on the voice, but over time, as the course progresses, there will be some deterioration in the voice quality and the swallowing muscles as well. So you'll be guided by a speech therapist during that process on managing that. Although the voice will be affected for a while, very often the voice does return. And it's a matter of to how much degree and how quickly, and hopefully with the good help of a voice therapist and someone to help with the swallowing as well, we aim to make as much recovery as possible for that person. So anytime somebody gets a cancer diagnosis on their vocal folds, and I've been there in the room when that happens, it's really deeply shocking for individuals. But it's one of the cancers that when caught, especially early, is very, very treatable, and it's one of the cancers that doesn't spread as easily. Once it's removed and treated, it can be just an isolated incident. It doesn't matter who you are, it can happen to anybody. Sometimes it happens to people who've never smoked in their whole life. Very often it happens more to males who have been heavy smokers, perhaps 50 and above. But just like all cancers, there's no rhyme or reason to it. If caught early, it's one of the cancers that can be treated successfully. And it's very well supported process, tend to get seen very quickly, and you also have the help of a voice therapist, speech and language therapist like me, to help you with voice recovery and managing through the process, and hopefully getting you back to as much voice as possible post-treatment. If you found the video helpful, click the like button and please subscribe to the channel.